Welcome to today's episode, and I'm so glad you're here with me. If you've ever been in a car accident, played contact sports, or even taken a hard fall, you might have experienced something that millions of people deal with every year: whiplash. It's one of those injuries that can sneak up on you, sometimes not showing symptoms until hours or even days after the initial incident. Today, we're going to dive deep into what whiplash really is, what causes it, how to recognize the symptoms, and most importantly, what you can do about it. Let me start with a story that might sound familiar. Picture this. You're sitting at a red light, maybe checking your phone or adjusting your radio, when suddenly you feel a jolt from behind. Someone rear-ended you. At first, you might feel fine, maybe a little shaken up, but nothing seems wrong. You exchange insurance information, drive home, and think you've dodged a bullet. Then the next morning, you wake up with a stiff neck that feels like you slept wrong for a week straight. That's whiplash making its unwelcome introduction. So what exactly is whiplash? Think of it this way. Your neck is designed to move in controlled, gradual motions. When whiplash occurs, your head gets snapped back and forth in a rapid, violent motion that your neck simply wasn't prepared for. The medical term is cervical strain or sprain, but whiplash perfectly captures what's happening. Your neck muscles, ligaments, and tendons get stretched and torn beyond their normal range of motion, kind of like pulling a rubber band too far and too fast. Now let's talk about what typically causes these injuries. While car accidents are definitely the most common culprit, especially rear-end collisions, they're not the only way you can end up with whiplash. Contact sports like football, rugby, or hockey can certainly do it. Even something as innocent as a playground accident or a slip and fall can cause that sudden jerking motion that leads to injury. What's interesting is that you don't need to be moving at high speeds for whiplash to occur. Even low-speed collisions, those fender benders that barely dent your car, can cause significant neck trauma. Here's where things get tricky, and this is something I really want you to understand. Whiplash symptoms don't always show up immediately. You might feel perfectly fine right after an accident, which is why so many people decline medical attention at the scene. But here's what's happening in your body during those first few hours and days. The most obvious symptom is neck pain and stiffness. This usually starts as a dull ache and can progress to sharp, intense pain that makes it difficult to turn your head. You might also experience headaches, and these aren't just ordinary headaches. They often start at the base of your skull and radiate upward, sometimes feeling like a tight band around your head. But whiplash affects more than just your neck. Many people experience shoulder pain that can extend down into their arms. You might feel tingling or numbness in your fingers, which happens when the injury affects the nerves that run from your neck down through your arms. Some people also report dizziness, fatigue, and even difficulty concentrating. Think about this. Your neck contains a complex network of muscles, nerves, and blood vessels, so when that area gets injured, it can affect your entire upper body and even your cognitive function. What's particularly concerning is that some people develop jaw problems after whiplash injuries. You might notice clicking sounds when you open your mouth, difficulty chewing, or even lockjaw. This happens because the same forceful motion that injures your neck can also affect the temporomandibular joint, which connects your jaw to your skull. Now, here's the key point about getting proper diagnosis. Don't wait. Even if you feel fine initially, it's crucial to see a healthcare professional as soon as possible after any incident that could cause whiplash. A proper evaluation typically includes a physical examination, where they'll check your range of motion, test your reflexes, and assess your muscle strength. They might also order imaging tests like X-rays or MRI scans to get a clear picture of what's happening inside your neck. What's interesting is that whiplash is often called an invisible injury because it doesn't always show up clearly on standard imaging. Your bones might look perfectly fine on an X-ray, but the soft tissue damage, the stretched ligaments, and strained muscles can cause significant pain and disability. Let's move on to recovery, because this is where many people get discouraged. The good news is that most whiplash injuries do heal, but the timeline can vary dramatically from person to person. Some people feel better within a few days or weeks, while others might deal with symptoms for months or even years. The severity of your injury, your overall health, and how quickly you get treatment all play important roles in your recovery. Early intervention is absolutely critical. The sooner you start appropriate treatment, the better your chances of a full recovery. This might include physical therapy to restore your range of motion and strengthen your neck muscles, pain management techniques, and sometimes medications to reduce inflammation and muscle spasms. Consider this. Your body has an amazing ability to heal itself, but it needs the right environment and support to do so effectively. Ignoring whiplash symptoms or trying to tough it out can actually make things worse and potentially lead to chronic pain issues down the road. Here's what I want you to take away from today's discussion. Whiplash is a serious injury that deserves serious attention. Don't let the fact that it's common fool you into thinking it's not important. If you've been in any kind of accident or experienced trauma that could have caused whiplash, get evaluated by a healthcare professional, even if you feel fine at the moment. If you're currently dealing with neck pain, headaches, or any of the other symptoms we've discussed today, don't wait for them to get worse. The team at East Coast Injury Clinic specializes in diagnosing and treating whiplash injuries, and they understand exactly what you're going through. You can visit their website or give them a call to schedule a consultation and take the first step toward getting your life back to normal. Remember, taking care of your health isn't just about feeling better today. It's about protecting your future well-being. Thanks for joining me today, and I'll see you next time.